It's not recording, or is it? Yes, now. All right, I'm starting the timer, and here is the question. Right, so if you read and understood, kindly tell me what is your provisional diagnosis?
Yes, ma'am. My provisional diagnosis would be a pleomorphic adenoma of the parotid gland.
Okay.
But I would also like to rule out other causes like stone, the parotid duct, any infective pathology, any inflammatory pathology, and
Yes.
any malignancies, be it benign or malignant.
Okay. So, how would you classify lesions at this region?
Okay. The lesion can be classified as benign or malignant. In
Yes.
benign, we have pleomorphic adenoma,
Yes.
Warthin's tumor, oncocytoma, ductal papillomas, and there can be also basal cell adenomas. In malignant, we have mucoepidermoid carcinoma, acinic cell carcinomas, adenoid cystic carcinomas. Then can be malignant mixed tumors, and it can be also stem cell carcinoma as well.
What do you understand by the term pleomorphic?
The term pleomorphic means there's a remarkable histological diversity of the cells.
Okay, what do you mean? Can you give some examples?
Like there's remarkable histological diversity. There are so many types of cells present in one tissue, like in pleomorphic adenoma. There's a mixture of ductal cells and mesenchymal cells. The ductal cells will be of epithelial origin, and mesenchymal cells will produce the myoepithelial cells. So there will be a combination of the epithelial and mesenchymal differentiation.
Okay, good. All right, can you tell me how can you investigate to make sure your diagnosis is right, or what investigation can you do or ask for?
After thorough history taking and clinical examination,
Yes.
I would like to take starting from bloods to check full blood count, inflammatory markers like CRP, ESR, and other baseline investigations. Then I would like to arrange an FNAC for this patient to rule out to make a diagnosis in this patient.
All
We
right.
can also go for radiology if needed, like CT scan.
Okay, why CT scan? Why
To
not
look for
MRI?
CT scan gives a rough idea about the bony extension. Better, it's also CT. We can look for the mass as well as its extension and bony involvement as well. We can go for MRI as well.
If you'll do FNAC, like you said, fine needle aspiration section, what would you get as a result, and how would you differentiate, or how would you learn if it's benign or malignant?
With FNAC, we can only came to know the cytological report, like the characteristic features of the cells only. But to differentiate it, whether it is invasive or not, we have to do a core biopsy to look for the histological change, like invasive basement membrane, which is the pathogenomic of the malignant cancer, malignant like malignancies.
Okay, Can you tell me if this patient, just suppose, is undergoing surgery and you suspect that lesion looks to be a malignant, how can you, or if you can, take a sample while you're operating on
Yes,
the
while
patient?
operating, we
Yes.
can go for frozen section
Yes.
biopsy,
Yes.
and that can give us idea whether it is malignant or it is benign.
Okay. All right. Can you tell me if there is any particular histological stain that you can use to rule out or to figure out these parotid tumors?
The the commonly used stains are eosin and
Yeah. Can you help me to
eosin.
read this? What is this pointing at? This image does not belong to this patient. It's just taken randomly from Google, but it's showing something. Can you?
It's showing a
Yes.
tissue, soft tissue hypodense lesion
Yes.
uh, in the region of parotid gland on the left
Yes.
side.
Yes.
That could be arising from the parotid gland,
Yes.
which could be the cause could be infective, inflammatory, like benign, malignant causes. Here. These could be the provisional things we
Yes.
can say.
Just suppose you're doing okay for this one, parotid tumors. Can you name some high sensitivity test and what are the high specificity tests? How would you define them, the terms?
Sensitivity is defined as the positive predictive value of a test, like how a test is going to show only the positive cases only,
Okay, good.
and specificity is defined as finding out the true negatives, like how many patients actually don't have the disease.
All right.
So
Can
it's sensitivity is also called true positive, specificity is also called true negative.
just imagine you're doing FNC of this patient and your assistant gets a needle injury. What would you do?
Firstly, we have to stop the procedure. Then we have to make squeeze at the site of the puncture to make free flow of the blood. We have to wash it. We have to inform the infectious disease control program of the hospital,
Yes.
and if needed, patient may need to and patient has to be tested to see him against the hepatitis B, hepatitis C, HIV status, and if needed, patient can attendant may need to take antiretroviral drugs or any prophylaxis if needed.
All right, just like this patient has come in your outdoor, once you look at the patient for the purpose of examination, how can you, or is it possible for you to say that patient has malignant tumor or malignant lesion? Is it
Yes,
possible? Yes,
there are some red flag signs which
yes,
can point us towards the signs of malignancy, like if there is facial nerve affection,
very good, yes,
if patient complains that he has recently increased a rapid increase in size of the lesion, if
yes,
the structure fixed to the underlying
very
structures
good,
or
yes.
overlying skin has been invaded. These are the red flag signs that can be
So,
suspect we can suspect it's a malignancy.
so if histology, if sample is taken and it's looked under the microscope, what are the features that will confirm your diagnosis?
if it can be either if there's an invasion, the basement membrane will be
Yes,
infiltrated. We can see also for the mitotic rate, the number of the mitosis
yes,
increase. Then
yes.
we have to look for the differentiation, whether it is moderate, it is well differentiated, is moderately differentiated, or it is undifferentiated. And also we have to look for the at times anaplastic features as well. In anaplastic, there will be loss of normal tissue architecture, pleomorphism will be present, hyperchromatic nuclei will be present, the nuclear cytoplasm ratio will be increased, there will be giant cells. But in the normal undifferent, like in normal differentiated, the cells will be of the same pattern as a normal tissue. In undifferentiated, these will not resemble the normal tissue, and also in undifferentiated there will be increased number of mitosis, pleomorphism, and this
Abnormal nuclei. Yes.
abnormal nuclei and staining will be more.
Very good. Excellent. Yes. What more I could have asked you? Almost everything I've covered.
Feedback.
Yes, please. Excellent. Good. Yes, what are they saying? My buddies. 6 comments only.
It's really good, ma'am. Dr.
Yes.
Ishfaq actually answered to
Yes.
the point, and
Yes.
he didn't answer extra. So that's why you could ask the next question. That is the main thing. That's good. That was good, really.
Okay, lymph nodes. What did you say, lymph node?
Ma'am,
What?
in CT scan, lymph nodes will be more. We can see it good. That's it, ma'am. In a
Yes.
good way.
H and E stain. Yes. Isn't this what he said? I think he said the same thing.
Yes.
Yeah, he
Yes.
said that he just forgot the
Yeah, first he said that, but then he remembered how to cover it.
Yeah,
But then
yeah,
in
yeah.
exam, Dr. Ishfaq, don't
Yeah.
say that. Just cover it. That most commonly it is used this, and I assume that it will be the same. Or just say
Okay,
it's
Actually, in
H&E.
frozen section, the difference is using of fixative. Like
Yes.
in normal biopsy, the fixative is paraffin is used, and it will take more than 1 week, 1 to 2 weeks. And in case of frozen section, polyethylene glycol or polyvinyl alcohol.
Where do you see
it.
brown cytoplasm? Epithelioid cells with brown cytoplasm. What could that be?
Dr. Ulfat, sorry, I thought you asked generally.
No, Google.
It's all
Find out.
right. It's all right.
Maybe it's melanoma. It's melanoma.
Melanoma.
brown
Okay.
cytoplasm.
Yes.
Yeah.
Malignant
Brown
melanoma.
red cytoplasm.
Yeah.
She was asking Dr. Ishfaq. He should have known. Yes.
Yeah.
No, I was just
He knows.
quickly.
Definitely.
Yeah.
He knows, I guess.
Actually,
Good.
Yeah.
like in FNAC, there were 3 things in the notes which have mentioned there. Like if you find lymphocytes and Langerhans giant cells, it would be suggestive of granuloma. If you find lymphoid cells with pleomorphism, that would be suggestive of lymphoma. And if you find epithelioid cells with brown cytoplasm, that would be suggestive of malignant melanoma.
This is good,
Good.
Dr. Ulfat.
Right.
They ask you, you ask them.
Yes.
In this way, you will both prepare each other. That's good. Excellent.
Yes. Yes, ma'am. Yes.
Good,
Very
thoughtful.
good, Dr. Ishwar. Thank you, ma'am.
Thank you. Good. Very thoughtful. Yes. Any more questions or feedback, please?
Ma'am,
Yes, please.
ma'am, in the provisional diagnosis, we have to say pleomorphic because I thought it was like some carcinoma. There was history of weight loss and everything.
No facial nerve involvement, Dr.
There
Ulfat.
was no facial, it's Dr. Binishak. There was no
Oh,
facial.
sorry.
Yes.
Okay.
We have to welcome new members as well. See,
There were no
facial nerve functions to be intact. And it is mobile mass.
Painless.
And then you have
This
to
is
look
painless.
47 years old and it is painless. So it's
So weight loss can be there in benign also.
of
weight
course,
loss.
patient is conscious, not eating. I don't know, and it's increasing in size in
Like,
last 3 years.
Yeah.
Could be any reason, you know. Sometimes people
This could be any reason, yeah.
And also, ma'am, it says that this is mobile and then facial nerve function is intact. So, just like ma'am
The facial
said,
nerve gets involved later on, but in the initial, if it is growing in the last 3 years and weight
18
loss,
years and it's increasing in last 13. So it's
it's,
long term.
It's long term. It's taking to
long term. Carcinoma can never have such a long history, you know. And there'll be more mileage, there'll be more, fatigue and mileage and all that. Symptoms will be like more pronounced.
And in the stem, it was mentioned like it was there for the past 18 years, and there was increase in size, but that was also in the last 3 years, and there were no red flag signs mentioned. Like one thing which was favoring pleomorphic adenoma was the facial nerve was intact. This thing you could have noticed it. And it was painless, it was mobile mass. There were no features, there were no signs and symptoms of malignancy. So our first should be that our first differential diagnosis should be pleomorphic adenoma.
Yes. True. So should we move on, or there is any more discussion? What could this be? This is carcinoma.
Ma'am,
It's look like homogeneous. Yeah.
It will be.
Yeah, Dr. Ishaq, please.
Yes. On CT, you can't actually say it's it is malignant or it is benign. You can only say the radiology feature.
Isn't there extension?
Okay.
Isn't there a little extension into this thing? It
What
looks
thing?
like it is unilateral underlying structure. See the extension of the tumor. It looks like there is to the underlying structure. That's why I'm saying, because
If
it's
I
unilateral
remember
also.
right, I think that was Warthin's tumor. They had labeled it like this, so that's why I'm saying.
Warthin's tumor is also a benign tumor, and on
But I'm
CT
not
you
sure.
can't differentiate
Yes.
between a malignant.
Yeah.
Oh, okay.
But I don't remember because it was.
Ma'am, according to the CT scan, what we can say
Yeah.
actually, there is homogeneous cystic structure which is surrounded by a capsule. That is the main thing. But
It's clear.
to confirm
Yes,
it, we have
capsule
to do.
is clear.
Yes.
Yes.
Yeah, ma'am.
Yes.
That you can clearly say. Clearly
Yeah,
see.
ma'am.
Yes. All right. Okay. Should we move on?
Yes, ma'am, please.
Yes, Dr. Abhishek, if you're ready, we can start with you.